Olivier, I think the political cost that you mentioned in the insurance is quite important, and we have seen that in some cases. So I'm going to go, I think this is a good segue to engage with Simon. I mean, Simon, you have been working with governments in the ARC and the Caribbean facility, and we have been discussing about that the opportunity costs for not insuring are quite important for not financing the losses in terms of loss opportunities in the future. And that also applies to the pandemics. If we want to bring it down to the lessons learned from your experiences from ARC in Africa or the Caribbean facilities, how would you go about negotiating? What are the lessons for negotiating the parameters for insurance, convincing governments to take this, to pay for insurance when they may not get anything in return for the next 2, 3, 5 years, which is the political cost that Olivier mentions, and then how do you go when you structure a product that gives value? How you determine what is the value of the insurance product for the governments?
Thanks, Panos. So I think I'll draw mainly on Africa and the African risk capacity, which is my current role. Although I worked with Olivier and many other colleagues, Nikhil and Jose and Hal on the Caribbean scheme as well. So I think a really big part of this is the risk analysis. And I think when we talk about insurance, we often think of it as a product, a single product. And I think we need to broaden that thought out to insurance as a discipline, if you like. And a big part of that discipline is risk analytics, is quantifying risk. And you have to quantify it before you can know how to manage it properly. And I think that one of the big things that we learned in the Caribbean very early on was when you put a risk profile of a country for hurricane risk in the Caribbean, which you think, well, the Ministry of Finance is bound to know what would happen if a hurricane hit. They didn't. They didn't know either what a particular hurricane or Mitch was mentioned earlier. What was the cost of Mitch in Nicaragua in 1998? We still can't really put a very good number on it, let alone at the actual time. And what's the probability of Mitch actually happening again? So those kind of concepts were frighteningly, to me anyway, and I think probably to Olivier too, alien to most of the people that we were talking to in the Ministries of Finance. It wasn't something that they had really considered in terms of both the immediate impacts, but also particularly the medium to long-term economic impacts. And so insurance can bring that discipline of quantifying the risk, understanding the risk, and then you can start to build in the tools. And if you go about it that way, then whatever tool it is, the cost-benefit analysis is much easier to demonstrate what the value proposition is. So for ARC, for instance, we have countries drought. These are the least developed countries. On the continent. We have 9 member countries right now, more we're working with to join. In all but one case this year, they're paying their own premiums. And this is countries like Niger, one of the poorest countries in the world, Mali, many other different priorities. So it's a long process. At ARC, after they've signed the ARC Treaty, they go through 12 to 18 months of engagement, very hands-on engagement, and we link it to contingency planning, but we also engage and with colleagues from the bank and other places on risk financing in general. But we did a study before we really got going on the country engagement, which suggested or demonstrated actually that the benefit of having funds early and for those funds to be well deployed for drought, this was about a 5-to-1 leverage of, so $1 spent in a traditional humanitarian response in a drought, if it was it would take $5 in a traditional humanitarian response situation to cover $1 if it was as a payout, which was going to fund a pre-designed implementation plan, which is what the ARC model is. So a 5-to-1 relationship with having that money early and also knowing how to deploy it. And that was a very good selling point for us. I think the other thing I would emphasize is bringing the countries into the system. I've heard a lot this morning already about the international community. There's a parallel high-level panel, Secretary General's high-level panel going on humanitarian financing, based on the fact that the traditional humanitarian financing, particularly for drought, but for other natural disasters as well, is broken. Ex post fundraising does not work. They never meet the needs, the true needs, and there's a chronic effect which just aggregates through time. So ARC's approach, one that I very much recommend, is that we need to embed at least a significant level of responsibility within the countries themselves. And that goes to building the surveillance, building the basic health infrastructure. And again, I'm not a health expert, but analogous, I think, to what we're doing with drought and other natural perils in Africa right now, incentivizing them to participate, helping them to quantify their risk, helping them to manage it, but also the contingency planning piece, being prepared to spend that money when it comes, so that it can be spent really efficiently.
Thank you, Simon. So you put a lot of emphasis on education among the various stakeholders to understand the cost and benefits of having insurance. Now, with the ARC and the natural disasters, whether they're floods or droughts, you have systems where you have triggers based on rainfall levels. This can be actually independently verified. We have now also satellite observations that they can help us. Now, with the pandemics, this is a little bit messier, I would say. So how would you deal with triggers that they are not as clean, like black and white, as we have on natural events? And how would you go settling claims when there can be gray areas, where you don't have something that is really very well defined as in an ex ante way. So how would you be working? And again, from your knowledge on the natural disasters, how would you advise that we deal with the pandemics?
So ARC received a mandate for ARC is a specialized agency of the African Union, and it received a mandate from the African Union heads at the beginning of this year to look into pandemic financing, and so the acting director general came to the technical folks, of which I was for some reason one, and asked, is this possible? Can we use the same kind of tools as we use for drought? And we're developing cyclone and flood models right now for pandemics. And from my perspective, the benefit of parametric insurance, which is when you have an independent trigger and the payout is triggered purely on that independent value metric of the hazard in the natural disaster case. The real benefit of it is that it is clean. You don't have that gray area. As long as you've written a good contract and your data source is reliable, and your historical data source, so your precedent, so your probabilistic analysis is sound, then both the claims management piece is very easy because there really is none. It's a single trigger. But I think more importantly, the risk financing is going to be very cost efficient. And that's because if you have a parametric mechanism, then the reinsurers, the likes of Nikhil and Nikhil's underwriters and Gunther's as well in Munich, that underwriter can actually look at a parametric product for drought in Africa, let's say, against a rainfall product in the Caribbean, or indeed a pandemic product, if it's well structured, pretty much independently of where it is and what the risk is. If you can quantify the risk, then the mechanism of underwriting is actually very, very much simplified, and the whole claims management is actually where the sweet spot of the reinsurers and the insurers' business is. That's where they make their money, in that claim, in that gray area. And if you can take that out, if you can take the gray area out, then the price of risk in the international markets, in my mind, is very, very cheap, and therefore you can make it cost effective for sovereigns to buy that coverage. If you lose that that cleanness, if you bring in the grey area, that's where you start to get the price starts to move towards. You lose a lot of the benefits of both on the pricing side, but also of the rapid payouts as well. And as we know, as I've just we've demonstrated for drought, and I'm pretty sure that for pandemics, having heard some of the stuff we've heard already, that the leveraging of rapid funds for a pandemic would be much greater than a 5 times. So the parametric nature of the insurance, I think, is really critical to enable that rapid payout. Now, how we solve that for pandemics, I think, is really the biggest question that us and colleagues who are working in various ways to try and solve that. That's the biggest question, and I'm certainly not an expert in the potential data sources, but I hope that it's something that we can think through as a community and come to some agreement. And it may well be that our first solution is not where we want to be, but that through putting something in place, then we start to develop systems that can help to. And basically, what we need is an independent source of information, either on infection rates or on death rates, on my view, for a known pathogen, and that's what we need. Or if it's not independent, then at least verifiable in some way by some kind of third party. So I can visualize what is needed. Whether we can get there or not, I'm not quite sure. And it may be that we have to do something in the interim, which is a somewhat softer trigger and product, and hopefully, certainly the big international reinsurers would be comfortable with that. And actually, I would posit and put it out there that actually they shouldn't be charging anything for this, because if you get money very quickly into a situation to prevent it spreading, then that's a pretty good hedge against their life insurance books, as we heard from Gordon earlier, and I'm sure Gordon would expand on that a little later. But if you can, the mitigation piece for the life insurers is huge, and it's a very good investment for them, actually.